Hello and welcome to a Health Podyssey. I'm your host, Alan Weil. Medical debt is the leading cause of bankruptcy in the United States, and 1 in 4 adults report that they avoid medical care due to cost. Now, prices for pretty much all healthcare goods and services are higher in the United States than elsewhere in the world. And while any bill can strain the budget, hospital bills warrant particular focus because one even short hospitalization can generate a bill that far exceeds the typical family's ability to pay. Enter charity care. Now, hospitals of all types offer free or discounted care to those with limited ability to pay. Nonprofit hospitals in particular have a long history of providing charity care as part of their nonprofit mission. And now, under the Affordable Care Act, they're required to have a written and available financial assistance policy. There are, however, no substantive requirements regarding what that assistance must be. So, what are hospitals' charity care policies? That's the topic of today's episode of A Health Podyssey. I'm here with Jared Walker, the founder of $4, a nonprofit based in Vancouver, Washington, focused entirely on reducing the burden of medical debt. Walker and colleagues published a paper in the November 2024 issue of Health Affairs analyzing data on nonprofit hospital charity care policies. We'll discuss what they found in today's episode. Mr. Walker, welcome to the program.
Thank you so much for having me. I appreciate it.
Yeah, this is unfortunately a great topic to talk about. Unfortunate because it's so common, but important to talk about because it is also so common. So let's just set the stage. What can you tell us about the role charity care plays in hospitals? How much of it do they provide? Do all of them offer about the same amount? Why do they even do this?
It's a great question. And unfortunately, it really varies hospital by hospital. We analyzed over 2,700 hospitals in this paper, and what they give out is really, there's a huge range as far as the amounts. And you can find that in like Hospital 990's Schedule H. And you can see sometimes they even leave it blank where it's kind of unknown. But, the reason I think also, varies is, obviously nonprofit hospitals have to do this in order to keep their tax exempt status. So that's obviously a big reason, but also, to their credit, community benefit. They want to, do the right thing. They want to do what's right in their community. And it just kind of depends. This is, obviously, we did the paper on nonprofit hospitals. I think for-profit, maybe there's a different answer, but that's, those are some reasons.
Yeah. So, like many things in the world, different enterprises come at it from different places, and they do what sort of fits with how it works for them. But it sure matters a lot on the consumer side, what the practices are. Let's talk for a minute, if we could, about medical debt. Your organization focuses exclusively on that. So, why are we looking at hospitals? Why is it that hospitals are such a critical part of the medical debt story? And sort of, again, where does the charity care story fit within the overall debt story?
I realized a few years ago when I found out about hospital charity care, because like so many, I just didn't know it existed. And a lot of people, they leave the hospital and they get that bill and they have absolutely no idea of the resources. So I realized that there are just millions and millions of people that are going on payment plans, declaring bankruptcy for bills that they actually don't have to pay, which is tragic because, you have this on paper, like a really great resource to people and more generous than a lot of people think. Hospital charity care, if anything, most people just assume that they're not eligible. But, they have some generous policies, and a lot of people would be able to get at least a discount and sometimes complete waiver of these bills. We did another research project earlier this year and determined like a pretty low estimate is that hospitals miss about $14 billion of charity care that should be given out to low and middle income households every year. So it's a pretty big impact.
Yeah, these are just sort of mind-blowing numbers. And the notion that people who are struggling to make ends meet have an interaction with the healthcare system. And as you say, they walk out, they get a bill, they assume they have to pay it, and they'll stretch all kinds of other parts of their budget to come up with the resources to pay it when maybe they didn't even have to. So that brings us really to your study that we published around what the policies are. You mentioned you focused on nonprofit hospitals. What did you find sort of at the basic level regarding eligibility for free and reduced cost care? Let's start with sort of the key criterion, which is income.
Yeah, so most hospitals, almost every single hospital, that's going to be the number one thing that they want to know is, who lives in your household and how much money do you make? That's, and then prove it, right? Proof of income and all of that. But they go based off of a percentage of the federal poverty level, which makes sense. But if you're a patient and you see, 200% FPL, you don't really know. Most people don't know what that means. And, where do they fall within that? So what we found is that most hospitals will give, a full discount, 100% waive of the bill. And then they'll usually have some type of sliding scale discount that will go up even further. So a really good example, I'm in the Pacific Northwest. Most hospitals in Oregon and Washington will waive 100% of your medical bills if you're at or below 300% of the federal poverty guidelines. And then they'll do a sliding scale up to 400%. Nationally, this is about 200% of the federal poverty guidelines for free care and about 400% for discounted care. And what does that mean? If you're a family of four, you can make a little over $100,000 gross annual income and still be eligible for a pretty good discount at most hospitals. And I said most people just assume that they don't qualify. It's just simply not the case. A lot of people actually do qualify. They might not be eligible for a full discount, but a 50% off is can be life-changing for people.
Absolutely. I can understand that hospitals are interested in helping people out who have low income, but it seems like sometimes there are other criteria than income that they look at in deciding who's going to get charity care. Can you tell me a little bit about what you found in that regard?
Yeah, originally when we built our database, we went and captured the federal poverty guideline criteria. But when we were building that, we started realizing that there were all of these other things thrown in there. Things like assets and things like even minimum bill amounts. Like you might not get charity care if your bill doesn't meet a certain amount. Insurance, residency, a lot of these different types of things that could also help you qualify or disqualify you. So this year, we built the rest of the database to expand all of that additional data.
It reminds me, Medicaid eligibility used to be really complicated, assets tests, all these other things that you describe. It's still plenty complicated, don't get me wrong. But the federal government did make some changes to strip away a lot of that complexity. It's amazing how, those kinds of criteria, they might make some intuitive sense. Of course, you don't want someone who has, $1 million house, who has no income, to say that they have nothing. But turns out situations like that are extremely rare, and yet the burden it places on people to prove what they do and don't have can be quite tremendous. So it sounds like hospitals are a little kind of behind the times when it comes to thinking about this.
I would say so. And, I think it's just a really interesting question. That people should ask themselves, like, what is the opinion of, should you have to sell your car in order to pay a medical bill? Should you have to sell off portions of your retirement? Should you have to sell a home? Or, I would say, no, I don't think that you should have to do those things, right? But there are hospitals that seem to be really, really concerned about the make and model of the car that you drive. And so it's very interesting. Although when you talk to them, it does seem like they will say, over and over again, oh, we would never expect anyone to do anything like that. We just want to know. It's like, okay, well, Well, why is that?
Yeah, and if it affects your eligibility determination, you may not want them to, but they may not have any choice. There are also sort of these general like hardship situations. It sounds like obviously people with low income facing a high bill are in a state of hardship, but are there other circumstances that people can say, hey, I need some help here?
Yeah, definitely. Most of these hospitals have, something called a hardship policy where even if you are above the income threshold, if the bill amount exceeds a percentage of your gross annual income, then you might also be eligible. So a number that we see here a lot is in the 10 to 20%. So, if you're making, and we actually see this often enough to realize that these can be really impactful because, let's say you're a single and you make $80,000, that's probably going to put you over the edge for income eligibility. But if your medical bill is $40,000, that's a pretty big deal. A lot of hospitals have those hardship policies, which is good. The question is how do you access them and how do you inform the hospital? Because most of the time the hospital is not going to be doing those calculations on your behalf. You're going to have to flag that to them.
Well, we've been talking a lot about the policies. I want to turn to sort of how hard it is to navigate the system and what we might do to improve it so that people who are eligible for charity care can get it. We'll cover those topics after we take a short break. And we're back. I'm speaking with Jared Walker, founder of $4. We're talking about a paper describing U.S. nonprofit hospitals' criteria for providing charity care. In the discussion so far, it's become clear to me that this is sort of like an old school welfare policy. You come in with your pay stubs, your car registration, maybe a few other things, and you lay them all out and hope that they'll grant you a waiver of some of the costs of your care. Doesn't really have to be that way. And I will say, whenever I talk to people who live in other countries, they're just floored that this is how we do things here. That's probably a topic for another day. But, your organization is based on trying to eliminate medical debt, and you built this database to allow us to publish your analysis. This seems really complicated. Can you just say a little bit about how do you find this information? How hard is it to find it? How many hours does it take to figure out what the landscape of charity care is in this country?
I'll give you a little context of our origin story that will bring a little light to this. At the beginning of 2021, I posted a TikTok video that told people how to find their hospital's financial assistance policy online. That video went on to get about 30 million views. So I think it is something that it's not that complicated to find if you know what you're looking for and you know what hospital financial assistance is and all of that. But I posted that video and I had tens of thousands of messages of people asking me, can you help me with my bills? Can you tell me if I'm eligible? And finding that information, 501R would say, that these policies have to be widely publicized and widely available. And what a lot of hospitals do with that information is they put a poster in the ER. They might put some fine print on the back of a bill, and then they'll post something on their website. But finding that, I always tell people, I challenge people, go to your hospital's website, go to the homepage, and try to find the charity care policy. It's difficult. It's usually 20 plus pages, and it's a lot of jargon that people don't understand. So I think that obviously is a barrier. Then you get into, okay, I found the policy. I think I'm eligible. How do I apply? And this is where we see the most barriers because the application itself is pretty simple. 2 pages. Who are you? What do you do? Where do you work? How much money do you make? And then prove it. What usually happens, though, is that you are either going to have to find that on their website and print it out at home and then mail or fax it back to the hospital with all of your proof of income and everything filled out, or they're going to mail you a packet, and then you're going to have to do that kind of same thing. So it just becomes really burdensome. And then all the while, I think, a lot of times people that are on the outside forget is the only reason that they're looking this stuff up is because they just had some type of medical emergency. These people are recovering from a surgery or going through chemo or had some type of emergency. And now they're getting bills that are stacking up and they're trying to navigate this. So I think it really becomes, really burdensome on the patient to try and navigate these programs when they're on their own, which is, obviously why we exist, trying to make this more known, more easy, more fair. But hopefully that answers a little bit of your question.
Yeah, no, it definitely does. And I like the way you've divided it sort of between finding it and navigating it, and both of them have barriers. So, a lot of us have spent a good amount of our professional careers trying to reduce people's need for this kind of care, either increasing access to insurance, trying to help keep the cost of healthcare down. It would be great to live in a country where we weren't talking about this subject, but we are here. And I guess my question to you, sort of sitting back, looking at the whole of what you've done and talked to folks about, is if we can't get rid of the need for charity care, what might we do to make it more likely that people who are eligible for it get it, or make it just easier for people to figure out whether or not they're eligible? I think you've touched on some of these topics, but I'd kind of like to ask it straight on. Like, is there a better way to do this?
Yeah, definitely. I think that number one is hospitals have been able to kind of flip the script on this a little bit, where they have presented this in a way that it is the patient's responsibility to find out and to navigate. When I believe, if you look at the law, it's actually on the hospital to tell patients about these programs and help them through it. So I think that would be number one. Just like the position needs to change. Hospitals need to do a better job of vetting patients for these programs when they're at the hospital, before they leave, intake, discharge, however they can. And then, that's just like, I would say, a pretty simple thing to do because they're already asking for, do you have insurance? Do you have, they're having them fill out the stuff. You should be able to figure out, a household size and income and tell a patient whether or not they're eligible. So I think that would be one thing. Then you get into the actual process. Well, we know, I've talked to so many hospitals now. They say, I was just talking to one, they said they mail out 12,000 of these applications every year through the mail, and they are only approving 2,000. So we know that mailing paper applications and expecting patients to mail or fax them back is not a great way to do it. So can we create online forms? Can we create QR codes, links? Can we, that alone, I mean, that's what we've done. All we've done as an organization is be able to tell a patient immediately if they're eligible, and then create a digital way of submitting it to the hospital. And our conversion rates are much, much higher than any hospital. So those are just some like very basic things. I think also there are hospitals, like we mentioned a little bit before, that throw in a lot of unnecessary questions. I can make jokes about some, we had one hospital in a rural county that asked, under the assets, it actually asked about livestock. How much livestock do you own? So I think that some of these hospitals can take a chill pill and not ask such intrusive questions like that, because, what are you supposed to do? Sell your cows because you can't afford your medical bill? Doesn't seem right. So that, that's what I would say. I could probably talk a little bit more about how they could make it better, but I would say finding out, helping patients see if they're eligible before they leave the hospital, because patients are coming to us 1 to 3 months after they get a bill. They've already stressed out about it. They don't know what to do. We need to move further upstream.
Well, that's so interesting. I've never run a hospital, but I will say what you said about insurance is so true. If they think you're eligible for Medicaid, they'll help you get it because they get paid more than nothing if you have coverage, even if they complain about what Medicaid pays them. And yet here is a situation where they're basically voluntarily accepting to not get paid or get paid less. And so I guess their incentive to do it isn't quite the same. And maybe if we had it so that they actually had an incentive to approve charity care, or a penalty if they didn't, among people who are eligible, it might make them put as many resources into it as they put into figuring out whether people are eligible for Medicaid.
Yeah, I think two things on that. One, you can look at what North Carolina just passed, where they actually are offering enhanced Medicaid reimbursements for people that are basically, in order to get those enhanced funds, you have to have better charity care policies and all of that. So obviously there's a little bit of a, incentive there. And every single hospital in the state of North Carolina signed up and opted into that program because obviously they wanted that. So I do think that there are some incentives you can build. I think that some of us in the space are just kind of shake our head at it because it's like, well, you're already tax exempt and you're getting plenty of benefits for doing this. And now we're adding more because they're not doing it well. The other thing is that hospitals spend a tremendous amount of money trying to collect from people that can't pay. So it's funny because I get asked all the time from potential donors, foundations, people that, if you're successful, aren't you going to bankrupt these poor hospitals? And it's like, no, we're not. You're not going to bankrupt a hospital because they're giving out too much charity care. In fact, we believe in a lot of cases, there is a financial case to be made that it is actually better and cheaper for the hospital to identify patients earlier rather than sending out, 30 different collections letters and going through that whole thing. The collections process is not cheap. So is that an incentive? I don't think so, but I think that there are hospitals that could make financial sense of actually, let's just help these patients that we know are eligible rather than put them through the ringer.
Well, Mr. Walker, thank you for what you do and for taking on such a complex topic and putting it in a form that our readers can read about it and our listeners can hear about it. I wish you didn't have to do this work. I wish we had a healthcare system that didn't put people in this situation, but given that it does, it's critical that there are resources for folks trying to navigate. And as you say, it comes at the worst possible time. And so the fact that we put people through this yet again after they've left the hospital is just another sign of the challenges we face. With all of that said, I do appreciate you analyzing the situation and explaining how it works and how it doesn't work and maybe how we could do it better. So thanks so much for being my guest today on Health Podyssey.
Thank you so much. Appreciate it.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about Health Podyssey.